Mozambique is grappling with overlapping crises that are pushing children to breaking point. A sharp rise in violence in the north has displaced tens of thousands more people in recent weeks, adding to the millions already affected by years of conflict. At the same time, climate-related disasters, from cyclones to floods, continue to devastate communities, destroy infrastructure, and disrupt essential services. UNICEF is warning that children are now facing a perfect storm of insecurity, hunger, trauma, and limited access to healthcare and education. To help us understand the scale of the crisis, which is and the help that's urgently needed, we're now joined live by Mary Louise Eagleton, who's UNICEF's representative in Mozambique. Mary Louise, thanks very much indeed for joining us. Welcome to the program.
Thanks for having me, Peter.
Perhaps you can start by painting a clear picture for us in terms of what the situation is like in Mozambique right now for children.
Well, as you said, Peter, it really is a perfect storm. We've seen over the last few weeks the sharpest rise in displacement of the conflict in the north of non-state armed groups moving from Cabo Delgado into new attacks in Nampula province, where over 100,000 people have been displaced. 65% of them are children living in really, really precarious circumstances, living out of the open. The rainy season has started, and the response from collectively just isn't enough, with funding cuts and difficulties in getting enough supplies to them for both protection and for life-saving interventions. So the situation is really precarious for these children who were already very vulnerable in the north of Mozambique.
So, how are these repeated waves of displacement affecting or impacting children's physical safety, mental well being, and access to basic health services?
So as these children and their families have been fleeing, they've had to leave with very short notice, really with nothing. No food, no belongings, and huge protection risks. So as the non-state armed groups are attacking these villages, they're also abducting and recruiting children into their groups. There is sexual violence against children, against women. And they're incredibly vulnerable and have seen things that no child should ever have to witness. So they're living with a lot of trauma, as well as a lack of basic services. We've also had repeated disease outbreaks in the north of Mozambique, including an ongoing cholera outbreak, and we're seeing a number of cases of acute watery diarrhea, which puts children already very fragile at extreme risk of illness and of death in these circumstances.
I guess access to certain areas must be really difficult for you, given the climate shocks, weather, and insecurity.
Yeah, just in the last year, Mozambique in the north saw three major cyclones that impacted millions and millions of people. And we're coming now again into the cyclone season. So we've pre-positioned, and partners in UNICEF, the government, have pre-positioned supplies in order to try to respond to the needs in those cyclones. But with this recent displacement, we're having to use those pre-positioned supplies for cyclones for these new displacements. So it's very, very concerning as we're going into a season where we expect the vulnerability to increase even more, and the means are very, very stretched thin. Children have also been out of school at regular intervals due to these cyclones, due to the conflict, due to the displacement, and that's disrupting their education. Where there is school, children are learning under trees with over 100 children per classroom per teacher, and learning outcomes are very, very poor as a result. In Mozambique, 8 out of every 10 children cannot read and understand a simple sentence by the age of 10. That's after 3 years of primary school. So you can imagine these repeated shocks on children's ability to survive and thrive is very, very concerning. Also in the north, over 50% of children live with chronic malnutrition. So by the age of 2, their brains haven't adequately developed. Then they have the issues of lack of learning, lack of education, and then a rate of over 50% of girls are pregnant before the age of 18 or married. We see that the 65% of the displaced are children. And when people ask me, how is that possible? Are children fleeing without their families? I think it's important to note that a lot of the mothers are children themselves. So the high rate of children is child mothers, often 13, 14, 15 years old, with their babies and their children themselves.
Wow. And very briefly, perhaps finally, what support are you urgently needing to make sure that this situation doesn't deteriorate further?
Well, we really need all hands on deck. The government are coordinating and mobilizing private sector, development partners, humanitarian partners. But as I said, supplies are already massively insufficient. We need increased humanitarian funding for this crisis, and also to be ready to support these families, these children, and communities as the cyclone season begins. We really need support, especially around health and nutrition, food, shelter, and critical supplies that can that support their hygiene, their dignity, and their survival.
Mary Louise, we're going to have to leave it there, but let's certainly hope that this international call that you've made help brings support and help to the desperate children in Mozambique. Thanks so much indeed for your time.
Many thanks for keeping eyes on Mozambique.
That's Mary Louise Eagleton, who's UNICEF's representative in Mozambique, giving us, sadly, the situation in Mozambique, where children in particular are really affected by the insecurity, the climate shocks, and disruptions that have been happening for some time now. And I think anecdotally, children 3 years in school still can't read and write. It's a really sad story to tell.